Have you ever used the term bipolar to describe someone or something unpredictable? I was at the airport recently and was about to go on a work trip. Suddenly, the flight departure time changed from 9:05 a.m. to 10:05 a.m. There was a collective sigh as everyone prepared to wait another hour. Not even 2 minutes went by as we all received an alert on our phones saying the flight was actually on time. That's when I heard the woman sitting next to me say, "This flight is so bipolar." It's common for people to use the term bipolar without really having a good understanding of what it is. That's why in this video, we will go over what bipolar disorder is. Bipolar disorder is a mental health condition that affects how a person feels and behaves. It's like a roller coaster for emotions, where individuals experience extreme mood swings. Imagine feeling super energetic, happy, and on top of the world one moment, and then suddenly feeling sad, hopeless, and low the next. These mood swings can be intense and challenging to manage. They aren't just the regular ups and downs that we all feel from time to time. They can affect a person's ability to handle everyday life. Work, relationships, and even basic activities may be impacted during these episodes. Let's talk about the brain. Turns out there are some pretty significant differences in brain structure and chemical makeup between someone with bipolar disorder and someone without. Our brains use chemical messengers called neurotransmitters to help maintain a state of equilibrium. Dopamine and serotonin are the two key players of mood regulation. Think of your emotional state as a scale. If we have too much of one neurotransmitter, our emotional balance is thrown off. If there's an imbalance in either dopamine or serotonin, it will influence our mood. In bipolar disorder, there's a dysregulation in these neurotransmitters. Going back to the scale example from earlier, imagine one side of the scale has too much dopamine. The excess dopamine creates a surge of energy and heightened mood. This is called manic episode. Now, suppose the opposite happens and there are low levels of dopamine in the brain. In that case, the equilibrium is interrupted again, leading to feelings of sadness and low energy. This is called a depressive episode. That's not the end of it. Structurally, the brain itself is different in people with bipolar disorder. Studies have shown that people with bipolar disorder have decreased gray matter in the prefrontal cortex and overall have a smaller prefrontal cortex by volume. So how does someone get bipolar disorder? Bipolar disorder is hereditary. That means it runs in families. Research has shown that having a family history of bipolar disorder can increase your chances of developing the disorder yourself. But that's not the only risk factor. Trauma and drug abuse are also factors that contribute to the likelihood of you developing the disorder. Now, let's talk about the two main types of bipolar disorders. First is bipolar 1. Bipolar 1 disorder involves two main types of episodes, manic and depressive. Manic episodes are characterized by intense periods of elevated or irritable mood, where people might feel super energetic, impulsive, and have less need for sleep. This phase can lead to some risky behaviors. Alongside manic episodes, individuals with bipolar 1 also experience depressive episodes, which bring persistent feelings of sadness, low energy, and changes in sleep and appetite. In some cases of bipolar 1 disorder, manic episodes may include psychotic features. Psychosis involves losing touch with reality and can manifest as hallucinations or delusions. So what does bipolar 2 look like? Bipolar 2 also has two types of episodes, hypomanic and depressive. Hypomanic episodes are like mood boosts, but not as extreme as in bipolar 1. People might feel more energized, creative, and impulsive, but less intensely. It's like having a surge of positivity without going over the top. Like bipolar 1, people with bipolar 2 also experience depressive episodes, which brings feelings of sadness, low energy, and changes in sleep and appetite. But the good news is, unlike bipolar 1, there are no psychotic features during hypomanic or depressive episodes of bipolar 2. People with bipolar 2 don't experience hallucinations or lose touch with reality during these mood swings. Bipolar 2 has a cyclical nature, meaning the mood swings come and go in patterns. So individuals move between the more positive energetic states of hypomania and the lower depressive states. It's important to remember that even though bipolar 2 appears less severe than bipolar 1, these shifts can still have a significant impact on daily functioning. They affect relationships, work, and overall well-being. So what triggers it? Like a lot of things in life, stress seems to be a pretty big trigger for a bipolar episode. We all experience stress differently and for different reasons, but things like losing a job, death of a family member, or breakups can all trigger a bipolar episode. That's why it's important to be aware of things that stress you out, to avoid them, or have practical tools to deal with them. Lack of sleep or a change in sleep patterns is not only a hallmark symptom of bipolar disorder, it's also a trigger. Drug abuse is another big trigger. In fact, a large percentage of people with bipolar disorder have a co-occurring substance abuse problem that makes this condition worse. Changes in hormones in the body after giving birth, along with changes in sleep patterns, have also been shown to trigger bipolar episodes. So how do we treat it? In short, long-term use of medication along with therapy is the most effective in helping people with bipolar disorder manage symptoms and lead a normal life. Bipolar disorder is not a rare condition. According to the World Health Organization estimates, 46 million people around the world are affected by bipolar disorder, and 2.8% of the US population is also affected. Bipolar disorder is a challenging condition, not just for the person who's been diagnosed, but also for the people around them. That's why it's important to educate yourself about what bipolar disorder is. Knowing more about it can prepare you to face it head-on. An important word of caution is to also be mindful of your language. Even today, there's still a lot of stigma attached to mental health. Instead of saying he is bipolar, say he is someone with bipolar disorder. Also, avoid using phrases like "you're so bipolar" to describe a simple shift in mood. Living with bipolar disorder can be challenging, but with understanding and support, stability is achievable. So if this video has been helpful to you, please hit the like button and consider subscribing to the channel for more content like this. As always, spread loving kindness to all beings around you and be the change you want to see in the world. Thank you so much for watching. See you in the next video.